My name is Karina Timmermans, and I was partners with Abby Fetch and McKenna Koima, and we did spinal cord injury. A spinal cord injury is damage to any part of the spinal cord or nerves at the end of the spinal canal, which often causes permanent changes in strength, sensation, and other body functions below the site of injury. Symptoms and assessment. Symptoms of a spinal cord injury can widely vary. The location of the injury on the spinal cord determines what part of the body is affected and how severe the symptoms are. Generally, the higher up the level of the injury is to the spinal cord, the more severe the symptoms. The most common symptoms of the spinal cord injuries include muscle weaknesses, loss of voluntary muscle movement in the chest, arms or legs, breathing problems, loss of feeling in the chest, arms or legs, and loss of bowel and bladder function. The first thing to do when assessing a patient with a spinal cord injury is to obtain the history of the accident in which the injury occurred. Next, it's important to do a primary survey where you focus on assessing the patient's airway, breathing, and circulation. And make sure to stabilize the head and neck. The secondary survey is a complete head-to-toe assessment where you check the patient's ability to feel sensation and motor movement. In the emergency room, doctors focus on maintaining an individual's ability to breathe, preventing shock, and mobilizing neck to prevent further spinal cord damage, and avoiding possible complications such as stool or urine retention, respiratory or cardiovascular difficulty, and formation of deep vein blood clots in the extremities. Causes. The leading causes of spinal cord injuries include motor vehicle accidents, falls, acts of violence, and sporting injuries. Spinal cord injuries caused by violence have increased dramatically in the last decade. The mechanism of injury influences the type of spinal cord injury and the degree of neurological deficit. There is no clear genetic contributions to susceptibility that have been defined. However, the majority of these injuries occur in ages 16 to 18, with approximately 80% involving men. The financial impact of acute spinal cord injuries is tremendous, but it is related to the age of most patients and the degree of disability. Diagnosis. First, there's a physical exam. In the emergency room, a doctor may be able to rule out a spinal cord injury by careful inspection and examination, testing for sensory function and movement, and by asking some questions about the accident. But if the injured person complains of neck pain, isn't fully awake, or has obvious signs of weakness or neurological injury, emergency diagnostic tests may be needed. These include X-rays, which can reveal vertebral problems, tumors, fractures, or degenerative changes in the spine. A CT scan can provide a better look at abnormalities seen on an X-ray. This scan uses computers to form a series of cross-sectional images that can define bone, disc, and other problems. An MRI uses a strong magnetic field and radio waves to produce computer-generated images. This test is very helpful for looking at the spinal cord and identifying herniated discs, blood clots, or other masses that may be compressing the spinal cord. You also do a psychosocial, which is ongoing assessments of the patient's and family's coping skills. This is critical in planning meaningful support to assist the patient in reaching their functional potential. Treatment. Urgent medical attention is critical to minimize the effects of any head or neck trauma. Therefore, treatment for a spinal cord injury often begins at the scene of the accident. Emergency personnel typically immobilize the spine as gently and quickly as using a rigid net. If you do have a spinal cord injury, you'll usually be admitted to the intensive care unit for treatment. Types of treatment include medications or immobilization to bring the spine into proper alignment. Surgery is often necessary to remove fragments of bones, foreign objects, herniated discs, or fractured vertebrae that appear to be compressing the spine. Surgery may also be needed to stabilize the spine. The last thing is rehabilitation, which is huge in spinal cord injuries. Spinal cord injury become more independent and some devices may also restore function. These include things such as modern wheelchairs, computer adaptation, electronic aids to daily living, electrical stimulation devices, and robotic gait training. Okay, follow up. Your doctor may not be able to give you a prognosis right away. Recovery, if it occurs, typically starts a week to 6 months after an injury. The fastest rate of recovery is often seen in the first 6 months, but some people experience small improvements for up to 1 to 2 years. Patients who suffer a traumatic experience recover most of their nerve function during the first 6 months after the injury, though some nerve health can return up to 5 years later. Time is fine refers to the critical first 48 hours after the injury, which is known as the acute phase of injury. Nerve tissue quickly dies during the acute phase, so promptly diagnosing patients and starting treatment is essential to preserving long-term health and quality of life. Although care during the first 48 hours after a spinal cord injury is critical, it doesn't end there. Continued medical management also plays a role in the prognosis and long-term outlook. Getting the right care, weeks, months, and even years after the injury can improve quality of life and chances of functional recovery. Life expectancy depends on the severity of the injury, where on the spine the injury occurs, and age. Life expectancy after injury ranges from 1.5 years for a ventilator-dependent patient older than 60 to 52.6 years for a 20-year-old patient with preserved motor function.